Okay, we're going to talk about essential oils for pregnancy and birth. There are so many great essential oils for pregnancy or birth. Today we're going to talk about 8 of them. So first I'm going to answer how do you use essential oils for pregnancy or in birth? The safest dilution to use for a pregnant woman is a 1% dilution, and that's 1 drop of essential oil to a tablespoon of carrier oil. And a carrier oil could be like coconut oil, almond oil, or some other oil that you choose to use. So that's the dilution rate that you want to use, unless you've been using them regularly, and then you might can do them a little bit stronger, or if your midwife recommends them being stronger than that. So the first oil that I'm going to talk about is lavender. I have that right here. And lavender it has so many uses. It's like the oil that can be used for anything. And some of the uses that you can think about are for anxiety, fatigue, fear, stress, insomnia, nausea, high blood pressure, headaches. You can rub it on places you might be getting stretch marks. You can use it for perineal massage or for soreness after birth, also on the perineum. You can also use it, this is one that is less known for, is for congestion. Lavender has the same properties that eucalyptus has that make it good for congestion, and sometimes even in stronger quantities. And it's super safe, both for pregnant women and also for your babies after birth. So if your baby gets congested, lavender is a safe and extremely effective alternative to use over eucalyptus. All right, the second oil we will talk about is lemon. Lemon has been shown to be effective against yeast. So you can dilute it and rub it on any area you might be experiencing a yeast infection. It's also good for nausea, and if you get any brown spots or pigmentation changes during your pregnancy, lemon can be used to help with that too. All right, peppermint is good for headache. It's the classic recommendation for nausea in that first trimester. It's good for fatigue. It will stimulate your brain, and it's really good for sore muscles too if you're getting some soreness, especially like in the 3rd trimester. Ylang ylang is great for relaxation. It's also great for emotional support. So if you're feeling a little bit down, rub some ylang ylang on. And it's really helpful for blood pressure issues. So if your blood pressure starts to go up in pregnancy, this is your oil. All right, grapefruits can be used for headache, constipation. It boosts your immune system, can give you a boost of energy, and it stimulates both your brain and your hormones to work correctly. So super great oil. Tea tree is great for acne. It's also a good one for yeast. It protects against bacteria and viruses, and it's an anti-inflammatory. Patchouli can help you relax. It relieves pain and inflammation. It's good for your respiratory tract as well. It's also a bug repellent, which is safe over the store-bought bug repellents that you could use while you're pregnant. It is mood lifting. It improves cognitive function, and it stimulates libido, which is often needed, especially in that 3rd trimester. And then the last one I want to talk about, and I saved this one for last because this is only good for birth. This is not a good oil for pregnancy. Clary sage oil can strengthen contractions. It can also help stimulate contractions to start if your body is close to being ready for birth. So it can help you bring on labor. It can also help with the birth of the placenta if your placenta is being a little sluggish. So this is a really great one to take to your birth, but you want to make sure you do not use it until you are ready to give birth, because it is not safe for pregnancy. All right, thank you. I hope you enjoyed.